Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. Today on the show, we have Koye Oyerinde. He is a pediatrician, and he wrote the Kevin MD article, The COVID-19 Pandemic Reveals Gaping Holes in Locum Tenens Contracts. Koye, welcome to the show.
Thank you very much for having me.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Yes, I'm a pediatrician and a public health expert. I was trained in Nigeria and later on in South Africa. And then later on, I came here to the States to do a pediatric residency. And I also obtained a doctorate in public health at the University of North Carolina at Chapel Hill. And for 5 years, I was a professor at Columbia University, the Mailman School of Public Health, a professor of global health.
And how has the pandemic affected both you and your practice?
Well, the pandemic has been a major issue in primary care pediatrics, not because the kids are the main victims of the virus. Parents don't want the kids to get infected. Parents don't want to get infected, so they avoid coming to practices. And so with a typical day of about 25 to 30 patients a day, it went down to maybe 2 to 3 a day. And so even though it's largely adults, aging population disease, the fear of contagion meant that we actually almost closed down the practice.
Now, is telemedicine an increasing amount of your practice since the pandemic started?
Yes. For my colleagues who remained in practice, it became the major way they communicated with their patients. But I had taken time off work at the end of last year, and then the pandemic set in, and I've been off work since then, trying to do some book writing and so on.
Okay. So let's get into your Kevin MD article. The COVID-19 pandemic reveals gaping holes in locum tenens contracts. Now, for those who haven't read your article, can you walk my audience through it and share the story of why you decided to write it?
I have always, because I have a background in public health, I've always taken time off clinical pediatrics to do some public health work. And it's mostly pro bono, but it's part of why I enjoy doing what I do. I go off to consult with governments around the world about certain health issues from time to time. And so I've used locums to break my contracts so I could go off and come back and keep the locum while I'm writing a report or something like that. So for me, in November, December, I was writing a book. By the end of January, the shell of the book was already done. And I was spending time now more with book editors to correct and revise the book. So that was a good time to have a locum. So I took the locum in Maine, Bangor, Maine, and lovely locum. I enjoyed the practice. And it was while I was on the locum that the COVID epidemic became an issue. And I was just there in my hotel thinking, okay, because my health insurance was linked to my permanent contract, which I had surrendered in November, December, I didn't have health insurance. Now I'm working in an environment where there's a COVID-19 outbreak without health insurance. I was based in Bangor, Maine, where my home is Minot, North Dakota. And I felt suddenly very vulnerable. I have no pre-existing conditions. I'm generally fit. I've never slept a night in a hospital. I just didn't see, ordinarily, I didn't consider myself a vulnerable person. Mm-hmm. But that moment with the COVID-19 outbreak, I just felt, this is actually not sustainable. You shouldn't be doing a locum in the middle of a pandemic without health insurance. So I went to read my insurance, my locum contract, and there was nothing about health insurance coverage in case I fell ill. I went to my computer for an old contract with a different locum agency. Same thing. Nothing there to suggest what they'll do if I fell ill.
Okay.
And for those who do locums, when you have to submit a timesheet. So the number of hours you work is how much you get paid. So if you were to have a flu, simple flu, and you couldn't go to work, I'm in pediatrics. If you have flu, you can take care of kids, right? Mm-hmm. So you're healthy and strong, you can be in your hotel, but with your sniffles and cough, you can't be around children. So you don't get to work. That means you don't get paid. So all of a sudden, I was now looking at two different things that affected my contract. One, if I fell ill, I couldn't work, so I won't be paid. Two, because I didn't have health insurance, if I took ill, that would be a serious crisis for me. And so the next day, I called the insurance, the Locum agency, to ask for what will happen. And in fairness to them, they were magnanimous. They said, well, we have the COVID-19 is an unprecedented event, and so we have put aside a fund. I call it the GoFundMe plan, GoFundMe backup plan, that if you fell ill, you could come and let us know, and we'll review your situation and support you if we have to. I was grateful for the plan, but I didn't think that was a good plan for me as an individual to depend on the graciousness of the local agency. And so by the time I left the contract, I felt I had to write the article because I'm sure that there'll be other people out there in my shoes who take these local contracts from time to time. And I think it's important for us to think again. I mean, if you read the contracts, they pay attention to your credentialing. Mm-hmm. They pay attention to your malpractice coverage. Well, that's protecting the local agency, it's protecting the hospital, but it doesn't protect you, the provider of the care. Sure. And what I think should happen is that the local agency should either require you to have health insurance before you took the contract, or they should at least provide access to insurance. So if you want to pay for it on your own, they should have some scheme by which you could pay for your own health insurance while you're on their contract.
Now, as far as you know, is that a common situation among all the different locums agencies in that very few of them, if any, provide health insurance coverage?
I'm not aware of any that provide any health insurance. And that's why I felt the article was important. I've worked with at least two, and both of them don't have health insurance coverage for their physicians. And I looked at others, and I see that it's just about the same thing everywhere.
When working with locums companies, there are so many, and my inbox gets inundated with so many different companies. What are some things that you should look for if a clinician is interested in working with a particular locums company?
Well, I think it's important to be sure that they are legitimate, they are credible. I think you should actually talk to somebody who's worked with them before. The ones I've worked with have been very good. You can rely on them to look out for you because sometimes you get sent off to places where you've never been before. The time that I've worked with local agencies, they've called me to make sure I was safe. They called me to make sure that the accommodation I had was good, the car rental service was okay, and so on. So you don't want to work with a tiny agency that doesn't have the resources to support you where you go to work.
And typically, how long is each contract when you start working for a particular hospital or clinic?
Well, the contracts vary. I for one, don't take anything less than a 3-month contract. Because if I'm going to ship myself from home to go live somewhere, then I want it to be long enough for me to know the local community, settle in, do my work, and then plan to leave when I'm leaving. I think it's too short to go away for a week or 4 weeks.
Sure.
So I always insist on a 3-month minimum contract. Yeah.
Now, you talked about the lack of health insurance in a lot of these contracts. What are some other red flags that clinicians should look out for when reviewing potential locums opportunities?
I think one of the red flags is how you get compensated. Sometimes when you read the contract, they state per hour compensation, and they avoid telling you that your lunch break is not compensated. And I think if I'm right there for 10 hours of the day, I'm not going home in the middle of lunch break to go and cook or go buy food or something. I think the whole 10 hours should include my lunch break. Mm-hmm. That should be compensated. Sure. Whereas most of them don't cover you for your lunch break. So your hour there, you don't get any pay for that hour.
We're talking to Koye Oyerinde. He's a pediatrician, and he wrote the Kevin MD article, the COVID-19 pandemic reveals gaping holes in locum tenens contracts. Now, how has the pandemic affected the locum tenens industries? Do you find that there's more opportunities out there since the pandemic started?
Yes and no. I'll say in certain areas. So I do only outpatient pediatrics, and that's been badly affected by the COVID-19 epidemic. One, because the daily census for patients in the outpatient practices, census have gone down dramatically since the epidemic. Because it's so low, most practices can handle what they have. They don't need extra hands. Whereas on the side of the hospitalists, the diversion of all the hospital-based physicians into critical care and emergency practices means that the need for locum doctors to cover for the roles that they've left behind while they've moved to critical care and emergency medicine. So I think for the hospitalists, it's a good time. There are more opportunities for locum. Whereas for outpatient practices, this is really not a very good time for locums.
And my final question, do you have a take-home message that you want to share with the Kevin MD audience?
My take-home message is locums are good. I think it's a good thing to be able to leave a full-time contract and go off somewhere and spend some time. And it's helped me see the country. I think it's a good thing to do locums. But I think it's important that we advocate that the health of the physicians doing locum should be protected. At the minimum, they either buy their own health insurance or the agency should factor that into how they write the contracts and how they pay for the contracts.
All right. Well, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thank you very much.